Well, infectious disease specialist Dr. Zain Chagla joins us this morning to answer more questions about the latest development of COVID-19. Let's start off. Do you need a negative test before you can get the vaccine?
No. The only requirement is people don't have active COVID-19 at the time, as they shouldn't be leaving their homes anyways with that.
Hmm.
There are recommendations if if you've had COVID-19 that's been documented in the past to maybe wait 90 days because you have some protection. Plus, it gives the chance for people who haven't to get it. But in reality, we know we don't diagnose every case of COVID-19, and there's individuals that are prior infected that will get the vaccine. We don't do any specific testing because it's just a waste of resources at this point. And there's still some benefit to getting the vaccine, even in that group, regardless.
Hmm. Now, does the vaccine give you 100% protection right away? Or is it like the flu shot where you got to wait a couple of weeks before the antibodies really kick in?
Yeah, so in the trials at about day 14, we started seeing people getting more protection than the placebo arm. And it was really optimal at day 7 after the second dose went in. So for Pfizer, that would be about day 28. For Moderna, that would be about day 35. It's still important, though, that even in those groups, there were people who got the vaccine that still got COVID. It was 95% less, but that still meant there was a 5% that still got COVID in that sense. So even with a full vaccine series, there's a possibility. That being said, the people that got COVID tended to have less symptomatic and severe disease. So there's even benefit to that group if you're the one that escapes.
Now, even if you do get the vaccine, could you still transmit it? Like, you could still pick it up from a surface and move it along somewhere else, right? It's just not necessarily going to affect you.
Yeah, and this is the big thing. We don't know 100% whether these vaccines prevent me from being asymptomatic and still shedding the virus, or really protect me from getting the virus when I'm exposed. There's some emerging data out of Israel suggesting actually that transmission does go down in people that get the vaccine. And as we know, Israel has had a huge program vaccinating their over 60-year-olds. And so we're going to learn this very soon, particularly in our long-term care sector. Does the vaccine really prevent people from getting infected when they're exposed, or does it just reduce their symptom severity? And I think that's going to be very big for how fast this gets under control. But in both scenarios, there's still a great benefit to getting the vaccine, even if it reduces symptoms. Again, I would take something that would reduce my chance of dying significantly, even if that's the only benefit from it.
I want to ask you on a personal level what you're seeing in the hospital that you work at. Just the effect of the overall pandemic and the cases coming in to hospital staff, to patients there. Is it a real atmosphere of fear and stress?
Yeah, it's interesting. There's a lot of different things going on. And I think there's this delicate balance we have every day with trying to balance our patient care with COVID, trying to balance care for people without COVID, and really try to get back to some of the care we missed during the pandemic. Trying to make things safe for the staff, realizing that unfortunately staff still get infected in the community, and that also is a problem to keeping it out of the hospital. But at the same time, there is this day-by-day increasing optimism. Many of our staff are getting vaccinated. We're seeing our long-term care colleagues get vaccinated. And so, there's certainly a stress and a stretch, but there's also a certain bit of hope to say that, our ability to function in the hospital, to be safe in the hospital, provide patient care safely, is getting better and better by the day. So, it's a mix of optimism as well as the stresses of what's happening around the province. But I think day by day, the optimism is growing more and more and more.
Okay, and so important that we all stay at home to keep that optimism up. Dr. Zain Chagla, thanks very much for joining us today. Stay
No
safe.
problem. All the best.